I'm Priscilla, and I'm the chair of the Hart House Debates and Dialogue Committee this year. We're a fully student-led committee based at the University of Toronto. I'm very delighted to welcome all of you here today, tuning in from all across the world. And I would like to start this event by acknowledging the land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit River. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we're all grateful to have the opportunity to work on this land. Before we get started, a couple of housekeeping notes. So this event will feature a live audience Q&A. Please submit your questions using the Q&A function at the bottom of your screen, and we will draw questions from there. This event is also being recorded. Should you have any questions, our committee members will be monitoring the main chat function on Zoom for your questions. And now I will introduce our alumni and keynote director this year, Wei-Wen, who will share a few words about this event.
Thank you, Priscilla, and thank you all for tuning in virtually to the Hart House Debates and Dialogue Committee's first event of this academic year, and also the first virtual event in our whole 100-year history. So we're very excited to have you. As Priscilla mentioned, my name is Hugh-Wen, and I'm the director of the Alumni and Keynote Subcommittee, and I have worked on this event with Chan and William, who will be speaking later. Given the massive impact of the COVID-19 pandemic on each of our lives, we thought it would be a very incredibly timely discussion to have, and we're super excited to hear from our very qualified guests shortly. For some context, over the past few months, we have seen governments around the world impose lockdowns, unveil economic stimulus packages, and race to support the development of a COVID-19 vaccine. However, not all countries are equal in their ability to respond to the multifaceted needs demanded by the crisis. Economically, the effects of unemployment have been felt most sharply by communities with minorities and migrant workers. Education has faced setbacks where remote learning is not an option, and countries with weaker health systems and those facing humanitarian crises are at risk of being left behind. With a virus that knows no borders, the role of the WHO in directing and coordinating global health responses is more crucial than ever. Still, limitations have resulted in the rise of rhetoric and actions that threaten global cooperation, which begs the question, how can the WHO support global health initiatives amidst global divide? This event will discuss the role of the WHO in managing public health crises and what member countries such as Canada can do to promote healthy societies everywhere. So with that, I'm very pleased to introduce you to our speaker and moderator, and I will start with reading the bio of our speaker, Dr. Peter Singer. Dr. Singer is the Special Advisor to the Director General of the WHO, Dr. Tedros Adhanom Ghebreyesus, and also an Assistant Director General of the WHO. In this role, he supports the Director General to transform the WHO into an organization sharply focused on impact at the country level. Dr. Singer co-chaired the transition team, was the architect of the WHO strategy and triple billion target, and works to guide implementation of the program budget. Before joining the WHO, Dr. Peter Singer was the Chief Executive Officer of Grand Challenges Canada and the Sun Life Financial Chair and the Director of the University of Toronto Joint Centre for Bioethics. He was also Professor of Medicine at the University of Toronto and Senior Scientist at the University Health Network. Thank you for joining us right now from Geneva, Dr. Singer.
Thank you.
I'm also incredibly pleased to introduce our moderator, Dr. Erica DiRuggiero. Dr. DiRuggiero is the Director of the Center for Global Health and Director of the Collaborative Specialization in Global Health and an Associate Professor at the Division of Social and Behavioral Health Sciences at the Dalla Lana School of Public Health. She also holds a cross-appointment as Associate Professor at the university's Institute of Health Policy Management and Evaluation. Dr. DiRuggiero's program of research examines how evidence affects global policy agendas related to employment, other determinants, and health equity in the context of the SDGs. Her work addresses governance-related questions about the roles of public and private partnerships in global institutions in the promotion of health, health equity, and the prevention of non-communicable diseases and related risk factors. Thanks for being here, Dr. DiRuggiero. So without further ado, I will invite Dr. Singer to take it away with his keynote remarks, and thanks everybody.
Well, thank you so much, and thanks to Hart House for this invitation. I'm really grateful for the opportunity to be here. to talk about global health in a crisis, where we are in our fight against COVID, and where we're headed. COVID is the worst crisis in global public health in 100 years. So the last time we were in as significant a crisis was just before this lecture series at Hart House started in the 1918 pandemic. There are over 30 million cases confirmed, reported to WHO, and sadly, 1 million people have died. COVID has ruined not only lives, but also livelihoods, and set back progress on development and the Sustainable Development Goals by years. At the outset, and on behalf of the World Health Organization, I would like to start by offering our sincere condolences to every family in Canada and around the world who's lost a loved one. And also, I would like to offer our deep appreciation and respect for every health worker in Canada and around the world, and indeed for every essential worker who have put themselves in harm's way to serve others. Yesterday was the 75th anniversary of the United Nations. COVID shows that the UN and WHO, which is a UN agency, have never been more important. I feel proud also of the role that Canada has played and the partnership between Canada and WHO, which brings real and practical benefits to Canadians and to people around the world. I'm particularly excited to be with you at this Hart House event and the University of Toronto for this discussion, and especially because the invitation came from students. As someone who has worked with students my entire life, I can't emphasize enough how vital young people are to solving the world's greatest challenges. You bring energy, you bring enthusiasm, you bring fresh ideas, and you bring an inherent desire to improve the status quo. So I'm grateful to be here with you, and I promise to keep my remarks short so we have plenty of time for questions. Let me start with a few words about the WHO, which I feel privileged to be serving. People sometimes ask, what good is the WHO? My response is that if the WHO didn't exist, we would be rushing to create it. Why? Because global threats require a global response. Global threats like pandemics, like climate change, like inequality, don't care for borders or politics or geography. Yes, each country must do its part in protecting its own people, but we also need the ability to act internationally, to coordinate, to cooperate. No one country, no matter how powerful, can contain the worldwide spread of COVID or respond to the many hot zones that flare up or equip people everywhere with the masks and the other personal protective equipment they need, or develop and equitably distribute vaccines, and I'll come back to that topic. For all of that, we need to work together. We need to work internationally. We need to work through the multilateral system, not just to protect others, but also to protect ourselves. Global action, international cooperation, multilateral action, as represented by the WHO, is in our self-interest. It's necessary to protect our national interest, our national security, and our national prosperity. Because when it comes to the spread of a global pandemic, none of us is safe until all of us is safe. So that's the job of WHO, and under the leadership of Dr. Tedros, our Director General, that's the job we've been doing to great impact. WHO first heard of the epidemic on December 31st of last year. By the first week of January, we were warning member states and the public of the threat, and shortly thereafter offering guidance. In the second week, we helped with the publication of the viral genome, which led in the third week to a partner laboratory in Germany posting the protocol for the diagnostic test that's still widely used today. In the fourth week, on January 30th, we declared a public health emergency of international concern. That is WHO's highest level of global emergency, of global alert under international law. And at that time, there were fewer than 100 cases and no deaths outside of China. Since then, WHO shipped tens of millions of diagnostics, personal protective equipment, and medical oxygen around the world to people who need it the most. We've trained millions of health workers, including in very important tasks like donning and doffing personal protective equipment. We have been part and led more than 100 surge missions to hotspots, worked through 149 country offices worldwide. Our professionals have offered technical guidance on COVID, which is relied upon by virtually every public health professional in the world. WHO brings together health ministers to share good practices, and that has been extremely important. And we've also led, with partners, the fight for new scientific tools, diagnostics, therapeutics, and vaccines through the Access to COVID Tools Accelerator, and I'll have a little more to say about that shortly. So I want to start by saying that WHO is playing an essential role in the fight against this pandemic that makes a literal, important, visceral, and essential impact on the lives and livelihoods of people right here in Canada. Now, I know you've heard criticisms and critiques, and some seem to believe that by knocking the international effort, including the work of WHO, they can even relieve themselves of their own accountabilities. I want to say that we all have a lot to learn, and after every major event, for example, Ebola, WHO has always learned lessons. We always do, we all do, and that's why an independent international panel has been struck to review the performance of the international response, including WHO's performance, and that is being co-led by the former president of Liberia and the former prime minister of New Zealand. Because even as we continue the fight against COVID, it's important that we all learn how we can do it even better. But I will also add this. After nearly 10 months since COVID was first detected, do you want to know the #1 indicator of national success in the fight against COVID? Those nations who've done well, what have they done that others haven't? They followed the advice of WHO and of Dr. Tedros. That's the answer. And that's the #1 difference maker. And I'll go into that in a little more detail now. So let me turn now from what has been done in the past to what is to come. We are not out of the woods. We are not even sure how big the forest is. As Dr. Tedros has emphasized since January, the most important foundations of the response have been and will continue to be the importance of global solidarity, national unity, engaging communities, and leadership. Did you know there's a 100-fold difference in mortality rate across G20 nations? What accounts for this? It shows that preparedness is necessary, but maybe not sufficient, because it's not only the capacity you have, and G20 countries, generally speaking, are well prepared, but it's also how you use it. And that requires leadership at all levels, including at the highest level. Now, further, with respect to these public health foundations that are based on global solidarity, the key response that rests at the heart of WHO's advice, and this has not changed since January and will stay the same going into the future, is to test, find, and isolate every case and trace and quarantine every contact. Also, of course, we need to physically distance, wear a mask, avoid poorly ventilated and crowded environments, stay home when we're sick, wash our hands. Now, the fact is that countries like Canada, the fall will present new challenges with the reopening of schools, the wider opening of our economies, the flu season, cooler weather bringing people indoors and into tighter, closer spaces. And I'm also very cognizant of the rates in the last few days and the concern that that brings. But always keep this in mind. We will get through this. We will get through this. We will get through this together. So the first area that I've examined looking forward has been the foundations, the public health foundations of the response. Now, I'd like to focus on new scientific tools, in particular diagnostics, therapeutics, and especially vaccines. A word of caution, vaccines are not a silver bullet. Even when we have vaccines, and we don't yet have a safe and effective vaccine, we will need to continue the public health foundations I've just discussed. It's not either or. We need to do it all. The vaccine story is truly unprecedented, with a remarkable pace of discovery. There are around 200 candidate vaccines, maybe more, in the pipeline, with 38 in human trials. But we must never let our haste get in the way of safety or efficacy. It's critical that we not ignore safety research protocols, because the blow that would be struck to trust and confidence cannot be afforded if we do not pay attention to safety and efficacy. Already, we have our work cut out for us because of those who oppose or even actively undermine vaccination. And let me say this very clearly, and Dr. Tedros has said this very clearly. WHO will only endorse a vaccine that is safe and effective. In addition to issues of safety and efficacy in relation to new scientific tools, WHO, with partners, has launched the Access to COVID Tools Accelerator to help speed the development of these new scientific tools, but very importantly, also to promote equitable access. Within the ACT Accelerator, there is the COVAX facility, which is a partnership among Gavi, the Vaccine Alliance, CEPI, the Coalition for Epidemic Preparedness, and WHO. The COVAX facility aims to deliver 2 billion doses of a vaccine by the end of 2021. Now, just this past Monday, we announced that 64 higher income economies, including Canada, have joined the COVAX facility, and an additional 38 higher income economies are expected to join soon. This makes a total of 156 economies in total that are part of the initiative, covering 2/3 of the world's population. This is a very significant accomplishment. And the key principle here is equitable access, because we know that more lives can be saved by giving vaccines first to some people in all countries rather than all people in some countries. This is also the best way to reopen international trade and travel. And by some people, the early allocation frameworks, which are still in draft, just to give you a sense, for example, envision distribution to health workers, to frontline health workers, and to people most at risk, like the elderly. Now, this doesn't completely replace bilateral deals, and we know many countries like Canada have struck bilateral deals. But COVAX acts as an insurance policy, because no one country can afford to place bets on every vaccine candidate. I'm proud that Canada signed on to COVAX and hope to see Canada continue to speak loudly, as it has done, in favor of equitable access and against a winner-take-all, strongest, richest come first mentality. So having talked about looking forward the key public health foundations and some of the new scientific tools, I'd like to turn to a third topic, which is that of recovery. This is a bit longer term on the horizon, but no less important than the other two topics I've discussed. I mentioned that COVID is a crisis in lives and livelihoods. G20 countries have spent more than $10 trillion in stimulus. But the solution to the economic problem, and this is a very important point, is to solve the health problem, the problem of COVID, including, of course, the public health foundations and the new scientific tools we just discussed. But beyond those public health foundations and new scientific tools, how will we get back on track to health in Canada, to the Sustainable Development Goals, which of course are universal? Innovation and partnerships will play an important role, including partnerships in the multilateral system, and maybe we can talk more about that in the discussion period. But what I want to emphasize right now is the role of primary health care. What is primary health care? Primary health care is essential health services, access to essential health services, a focus on determinants of health that often are outside the health system, so it's multisectoral, and also community empowerment. These are the same as the public health foundations that I talked about earlier. Primary health care includes pandemic preparedness because some of those essential health services are essential public health functions. The other thing to emphasize is primary health care has a very, very strong equity focus in terms of leaving no one behind. COVID has exploited the cracks in our society. It is the vulnerable who have suffered the most, and primary health care has at its heart addressing these inequities. For WHO, primary health care has always been a sustaining goal. 42 years ago now, WHO helped to lead the declaration of Alma Ata on primary health care. Now we have the Astana framework, which is refreshing Alma Ata. We've launched a special program in primary health care. We have a global action plan for healthy lives and well-being, where 12 multilateral agencies work together to promote primary health care. For Canada, primary health care has also long been a strength. In 1974, the Lalonde Report on New Perspectives on the Health of Canadians introduced a fresh perspective on health promotion, for example, very much part of primary health care. And on the foreign affairs side, Global Affairs Canada has long supported health systems. Now, as the pandemic has shown, and in an interdependent world, we all have a stake in the well-being of one another. A weak health system halfway around the world might prove to be the foothold that a novel virus, and COVID is a novel virus. It moves fast, it's a killer, and we're continuing to learn new things about it every day. A weak health system is the foothold that a novel virus needs to find its place and make its way elsewhere. What happens to others can happen to us. What happens elsewhere can happen in Canada. Of course, there's a moral argument for primary health care, and I've talked about that. But it also comes down to cold, crass self-interest. So primary health care, with an underlying focus on equity, including gender equality, is another area where Canada can lead and work closely together with WHO. I'd now like to conclude and leave lots of time for our discussion period. And I'll wrap up by adding just one more thing, and it's going back to where I began. I spoke of the challenges of global health in a crisis. Where I began was with students, with young people, with you. Now, if we ask people to support the multilateral system and the public health foundations I was talking about, you'll find the overwhelming majority of people will agree. If we ask people whether they support the distribution of a vaccine fairly and equitably to all, you'll find the overwhelming majority of people will agree. If we ask people whether we should strengthen primary health care everywhere, you'll find the overwhelming majority of people will agree. The challenge is not really one of public consensus or agreement on these issues. It's one of public voice. And by that, I mean your voice. On these critical questions, whether it's multilateralism and the public health foundations, global solidarity, whether it's the new scientific tools and vaccines, whether it's primary health care. On these critical questions, let's ensure that leaders everywhere hear your voice. Let's ensure that they echo it. And let's ensure that they bend those few who might think otherwise toward justice. The most effective voice is yours, the voice of students, the voice of young people, your voice. That's the opportunity available to us now and moving forward. Please let's seize it. Thank you very much for your attention. Merci beaucoup. I very much look forward to your questions and comments. Thank you.
Thanks so much, Peter, for your thought-provoking remarks. And I think you've spoken really eloquently to the many contributions that WHO has already made in the face of COVID-19, some of which are actually probably quite invisible to the average person. And so I think it's an important recognition of its importance in this very challenging context. Also really appreciated as a strong supporter of students, your call to action to this generation to help reshape what kind of world we want, and how COVID-19 has really provided a bit of an inflection point for us to take a second sober look at the many social health and economic systems that make societies function, not always so well for especially most marginalized peoples. I'm going to start off with a few questions, and then rest assured, everyone who's signed in, we have lots of time for Q&A from the audience, so please start to think about your questions, and I see we've got a few already percolating. But I'd like to sort of go back to WHO and its constitution. Interestingly, and I know you know this, Peter, but WHO was actually created out of a crisis. It was created in the post-World War II era, interestingly, and fast-tracked to 2020, it's being, criticized in a context of crisis. So you've already alluded to some of the big challenges that an organization like this that has a huge mandate faces. But I'd like to sort of turn our attention to what do you think is really needed to strengthen the organization's ability to act collectively on behalf of member countries in the face of a pandemic like this one and other crises that are coming down the pipe.
Thank you, Erica. And it's really terrific to reconnect with you as well. We were colleagues for many years when I was at the University of Toronto, and thank you for that question. I think the first thing that's needed on the part of all of us is humility. Mm-hmm. And that's why I tried to make the point that we're always learning. WHO is, we all are. And that's very, very important characteristic, I think, for all of us. Secondly, what I'd like to say is that when Dr. Tedros came in 2017, and I had the privilege of coming with him, he initiated a transformation of WHO that is probably the biggest reform of WHO in its 72-year history. Mm-hmm. He brought in a general program of work, which is essentially a strategy with a triple billion target, 1 billion more people with universal health coverage, 1 billion more people better protected from health emergencies, 1 billion people living healthier and healthy and well-being, with healthier lives and with well-being. That's already very unusual to have a quantitative target across the whole organization where the budget supports it, the investment case supports it, there's a results framework, there's measurement, it's driving change. So the platform is already one of significant reform. Having said that, in the specific area of health emergencies, it's very clear that the world wasn't prepared. Mm-hmm. And, Dr. Tedros talks about this cycle of panic and neglect. So I don't want to go into detail about the particular reforms there because we've struck, or an independent panel has been struck, and it's very important that we listen carefully to their recommendations. But I think to answer your question about what we need is we all need to be humble. We all need to recognize that these institutions are already reforming. Mm-hmm. I mean, WHO is a results-based organization. Mm-hmm. And that we all have a lot to learn, and we really look forward to the recommendations of the independent panel.
Great. Yeah, actually, I'd like to pick up on, I think, that very important principle of global health, which is humility, given the interconnections between our countries. And you alluded to this point around lessons learned, because this isn't our first rodeo, even though it's one of a significant proportion. And as you said, the last one really was back in 1918. Again, at the end of the First World War, interestingly. So you talked about the fact that this is a learning organization. Are there any circumstantial differences between current and past pandemics? So H1N1, SARS, Ebola, which were more regional, I guess. They didn't have the same kind of reach. That WHO is learning from. Are there some concrete examples of actual lessons learned? Because many have remarked that we failed to learn from history and from our failures. And so are there some examples of where you think WHO has truly learned from its management of those past pandemics?
Yes, I'll just give you one concrete example, Erica. So after the reviews related to Ebola 2014 and so on, there was an increased focus on preparedness. And as part of the transformation I mentioned in 2017, 2018, even 2019, before COVID, Dr. Tedros created a Department of Preparedness in the emergencies group. I mean, the whole emergencies program actually came into a very significant reform after Ebola, and then as part of the transformation, the Department of Preparedness. So a focus on that. That's one concrete example, which is what you were asking about. The other thing I'd like to say is a lot of the learning happens in real time. So for example, every week there's a session where often health ministers are presenting the experience of their countries. Canada has presented as well, the Canadian health minister, and the learning, peer-to-peer learning that happens on that platform. And I think it's only WHO that could actually be the platform to do that, being governed by 194 countries in the world. That real-time learning, I think, is also really important. So it's not just a historical thing before COVID, it's real-time learning during COVID as well.
Yeah, I think that's a great point, because it speaks to the convening power that WHO uniquely has to bring the different players to learn in real time, as you say, and from, especially when you're managing under a lot of uncertainty. I think having as many people at the table to help shape responses is really critical. You may not be able to comment on this yet, because I think you alluded to a review process, but we're part of WHO's $1 billion target, which was this initiative to improve well-being of billions by 2023. But with this deadline of 2023, 3 years away or less, can you say what progress has been made? And I appreciate that COVID has probably thrown in a bit of a monkey wrench into that progress. Any progress? And then what do you think are some of the actions that are really critical to make progress towards this bold target?
Thank you. So the first thing to say is that $1 billion target is actually very heavily based on the Sustainable Development Goals. It's almost a way of saying, okay, if you wanted to take the 50 or so health-related targets out of the 172 or so targets, and how would you represent those in a strategy? That's really what the $1 billion target is. Now, I also want to say there's a lot of hope. You know, when I was born, 20 million kids were dying under the age of 5. And now that number has been reduced by more than 3/4. So, you know, if you take the long view here, there's a huge amount of hope in terms of what's happening in the world in some of these very important areas like child mortality. But you're right, it was difficult for us to be on track before COVID. For example, only about half the people in the world have access to universal health coverage, which is both access to essential services and financial protection. And it was already clear that we were going to fall short on some targets, and in particular, countries were, because it's the countries that have agreed to the Sustainable Development Goals and the $1 billion target. WHO helps countries to reach that. But COVID has really set us back, and this is extremely sad. Erica. It set us back by years. In the recent letter from the Gates Foundation, the phrase was, we've been set back by 25 years and 25 weeks. Now, I don't know if it's 25 years, but it's a significant setback. So that means we have to really redouble our efforts to accelerate progress and get back on track. How do we do that? First, we have to solve the COVID issue. And I talked about the public health measures, which are so important, and the scientific tools, and all on a foundation of global solidarity. Second, we need to innovate. We need to do things better, faster, cheaper, because the old ways aren't enough. And we need to work in partnership. So I mentioned the Global Action Plan, which is 12 large multilateral agencies, WHO, UNICEF, UNDP, UN Women, but also Gavi, Global Fund, World Bank, and so on, all working together more and more effectively and efficiently to support countries. So innovation and partnerships. But third, I think that primary health care with a firm commitment to equity on the basis of gender equality, on the basis of paying attention to Black Lives Matter, paying serious attention to climate, all these points in primary health care with equity as its base are also very important for building back. So in summary, we were off track before, we're much further off track now. And so we really have to think smartly about how we can catch up. And let me just end by saying the Sustainable Development Goals are not for poor countries. They are universal. They are for all of us. And inequities exist in every country in the world. And so this is something that we all must focus on.
Yeah, I think it still surprises me how many people think that SDGs are not about Canada. And I think within academic institutions like the University of Toronto, we're really trying to change that sensitization process, that we are all in this together, and the SDGs give us a bold agenda for working in more interdependent and collaborative ways. You touched already on sort of my next question around universal health coverage, and I think it's also an example of a goal that really highlights some of the horizontal policy decisions that we need to be doing a better job at, because we tend to focus very much on vertical programming, and there is a place for that, but I think your comments around a vaccine is not a magic bullet. I think illustrate the fact that we will still need very strong implementation systems in health and other systems to deliver a vaccine or a set of vaccines equitably. Are there countries that you feel have been doing this right, even just before, if we can imagine a world before COVID, that have been really, I think, moving the needle on strengthening their primary healthcare systems, which is such a foundation for universal health coverage? Any thoughts about that?
Yeah, I mean, maybe I'll just take the example of Ethiopia, because one of the, I think, really important things about the leadership of Dr. Tedros is that he was a health minister before he became Director General of WHO. And in fact, I was blown away, Erica, when I learned that he was actually the first health minister to become Director General. It's amazing.
It is.
He was also the first foreign minister, the first Director General from Africa. I mean, it's really incredible. And his vision as health minister was very much focused on primary health care. And you saw the correlative drops in child maternal death rates and so on in Ethiopia. So that would be just one handy example. There are, of course, historical examples of many countries that embraced primary health care around the time of Alma-Ata. But that Alma-Ata experience, as you well know, also ran into certain problems because it became focused on kind of basic health care for poor people, if you will. And primary health care is something that's important in every health system in the world. It's part of resilience, it's part of preparedness, it's part of engaging communities. It's part of, I mean, just think about the importance of hand washing in COVID. You know, these are all primary health. Let me just end with one example.
Sure.
As you know, and this is one of the saddest statistics in the world, about 800,000 children die every year from pneumonia. And a lot of those children probably are dying because they don't have access to medical oxygen. Oxygen saves lives. Now with COVID, and this is part of building back better in primary healthcare, there's, as I mentioned, a lot of oxygen concentrators, other types of oxygen delivery mechanisms, even oxygen innovations in business models and in solar powered oxygen and so on, that are going into countries. And that's going to be very important in saving the lives of people with COVID. But I'm hoping and I'm confident that it will also be important in saving the lives of children with pneumonia. And that's at the primary care level, primary health care level. And so I think thinking about primary health care as resilience and preparedness, as really finding a way to save lives that these children should not be dying. And here is a chance actually for some of these children's lives to be saved alongside the very important life-saving effect of oxygen on people who have COVID. That are obviously the most immediate issue.
I mean, it's a great example of, what's been coined in the past as the no-to gap. We know what to do, but there's a gap in the delivery and the access, which, as you say, is really unquestionable, the right thing to do, but there are many other forces that prevent this from happening. I think the other important thing for us to bear in mind is primary healthcare is first point of contact in the health system, and also works very much closely with public health and the advocates and others who are working on the social determinants of health. So really, I think, which was one of the critiques of the MDGs, of not paying sufficient attention to the social determinants and health equity. So I think your points really underscore some of those lessons from the past. So we have about 15 more minutes for this dialogue. And so I'm just going to prime the audience to continue to get their questions ready. But if I may sort of shift our discussion now to Canada and Canada's role in WHO. And so I think I'm sure have heard this phrase that Canada has been dubbed a middle power in the international sphere, providing a lot of moral leadership and promoting diplomacy as a solution to achieve global problems. But its presence hasn't always been considered to be as optimal. And I just if anyone's interested, there was a very good supplement in The Lancet back in 2018 that took a critical look at Canada's successes in the global health realm, including our own universal healthcare system that has some of its own challenges, our role in leading the development of the Ebola vaccine. So there are many sort of accomplishments also on the research front. So as WHO looks to strengthen its leadership in global health, what do you think is the opportunity, and there may be more than one, of course, for Canada to shape the global health agenda? And what role can our country play in a revitalized WHO, which, of course, as you alluded to, is already in transformation?
Yeah, thank you, Erica. So, just up front, I have to say WHO treats all its 194 member states the same. I'm an international public servant, and I think about every country the same. I'm also a proud Canadian. I think, Canada's always had an important role in WHO. I think most of your students probably know, but I'm not sure you tell me, that the first Director General of WHO was a Canadian, Brock Chisholm. And so Canada's been there right from the beginning. It's had a strong set of relationships for 72 years. The focus on polio, maternal, newborn, and child health, et cetera, et cetera. So Canada's always been there with WHO, and Canada's always been a strong proponent of the multilateral system. And if there's one thing I've learned through COVID, it's the importance of the multilateral system and the importance of WHO, especially for the most vulnerable people in the world. I don't want to presume to say to Canada what Canada should do. That's up to Canadians, that's up to the government of Canada. But let me talk about some of the things that have already happened that are obvious in terms of the strategic basis of the relationship. Firstly, Canada has joined, as I mentioned, COVAX. It's been a strong proponent of the ACT Accelerator. The Prime Minister was there at the launch, and I think that's very important, and especially with the scientific prowess, and this takes me back to my earlier life that Canada has. Do you know, for example, that in 1955, or just after 1955, some of the early lots of the Salk vaccine for polio that were used in trials around the world and in Canada were produced at Keynote Laboratories, which was part of the University of Toronto. So there's a history there. Anyway, so the search for a vaccine, the search for scientific tools, the participation in that is something Canada has already declared itself on. Secondly, primary health care. And I tried to make that point. There is a readout that you can find on the internet of a conversation between the development minister and Dr. Tedros from about 2 or 3 months ago that actually emphasizes the potential role in primary health care. Underlying that, Canada is a strong proponent of the multilateral system. So I mentioned the Global Action Plan for Healthy Lives and Wellbeing. That's 12 multilateral agencies that want to have stronger collaboration for better health, supporting countries. So that anyone who supports multilateralism would have to support that, because that is the multilateral system. And then, of course, Canada's focus on gender equality, on climate, play into the whole relationship in ways I've described. And more broadly, I mentioned that this was a crisis of historic proportions of lives and livelihoods. And one of the things you could see, if you look at Canada's record of support over the past 6 months, it's supported, for example, World Food Program in issues of hunger. It supported other humanitarian agencies with a focus on the most vulnerable people, migrants, refugees, and so on. And this has all been, I think, extremely important. So, Erica, it's not up to me to determine.
No, of course, I wasn't.
On the other hand, but on the other hand, I think if we look at the recent record of what Canada has done, even in the past 6 to 12 months, and I've only cited things that are publicly available, you can start to see a really important pattern of cooperation and support, mutual support between Canada and the World Health Organization, which, as an international public servant and a WHO senior official, I'm delighted by, and as a Canadian, I feel proud of.
That's great. Yeah, and I know that there are many countries that make up WHO. I think it's just important for our audience to bear in mind that Canada is making contributions. Some of them, again, are not as visible, and they're also based on, I think, past commitments and also leadership in research and policy, which brings me to a point you made about the Lalonde report, which of course was back to 1974, which really, I think, was a key foundational document in sort of thinking about how to reorient health systems and trying to strike a better balance. And it's not about pitting prevention against treatment, but trying to reorient our health systems. And so I think that's a good example of sort of intellectual leadership that Canada, and that document continues to be cited, today, and you yourself mentioned it. I just have a few more questions, and then we'll sort of open it up to the audience questions. Back in 2010, and I think we interacted around that time, so I guess that's already 10 years ago, you chaired the expert panel on Canada's strategic role in global health to assess the rationale and opportunity for Canada to take on a greater role in global health. And I'm not going to ask you to comment on what Canada should do, but just maybe reflect back to that time. And there were 5 areas that were already identified, and some of these you've already touched on, where Canada could take on a greater leadership. I'm going to start with the one we haven't touched on, which I think is so central to our own country and many other countries, and that speaks to the health of our Indigenous peoples. And so this was actually one of the areas that was identified. And so any thoughts on, how this issue more generally is being considered in global discussions? Certainly it's central to how Canada should be bringing forth its position, I would argue, but any thoughts on Indigenous?
Yeah, thank you. So WHO, in some of its early guidance and in some of the early press conferences, did focus on and continues to focus on the health of Indigenous people. And zeroing it, which, as you know, they're Indigenous people in many countries around the world. And it also relates to the issue of inequities. If we zero in on Canada, the inequities, the differences in health outcomes between Indigenous and non-Indigenous people, as I think everyone knows, are very, very significant and really need to be addressed. And so the innovative thing about that report was actually that it considered Indigenous health in the scope of Canada's role in global health. Since that time, many important things have happened by Indigenous people themselves, because the catchphrase, nothing about us without us, is extremely important. So we really have to acknowledge and celebrate the Indigenous leadership. And I was glad that this session started with land acknowledgement. Building on that, one of the other themes in that report was innovation. And so one of the things I feel really proud of, and now I'm going obviously a bit beyond my WHO hat, is that Grand Challenges Canada has launched an Indigenous Innovation Initiative led by Indigenous people, Indigenous leaders, and focusing on bringing that same platform as a back office to domestic problems. It shows us that what we were talking about before, the international and the domestic are not, there's no kind of magic curtain there. And on that issue of innovation, I think Canada has a very important role to play as well. And I mentioned, for example, the solar-powered oxygen, and many, many innovations that Canada can bring to the world, and that was one of the roles there. But at that point, it was more of a strategy. At this point, it's more of a what's been done, what's the partnership like, and I just feel overall proud about the fact that Canada is playing a significant role, and there's much, much more that it can do. From this standpoint, I can see what various countries do in relationship to multilateralism. And happy Canada is there, and would really look forward to that relationship strengthening. But again, the caveat is I'm here as an international public servant. And so we treat 194 countries the same, and we hope all of them will be strong supporters of multilateralism and committed to equity and committed to really getting back on track towards the sustainable development goals that every country in the world has agreed to.
I mean, I think it's heartening to see how some of those recommendations that were made 10 years ago are starting to be acted on, I think, irrespective of COVID. And then for those of you who aren't familiar with the others, it also signals a very important message you've already made, Peter, which is around community-oriented primary health care, this emphasis on population and public health. I mean, certainly in all countries, public health systems have been put to the major test in continuing to maintain trust of the public in the face of uncertainty and changing evidence, and being responsive to this very complex pandemic. And then I think you also echoed beautifully the point around the need for innovation, social innovation, technological innovation, married with how these can be deployed in organizational systems so that we don't stay static, but that we really learn in real time. And this is an opportunity to innovate. And finally, I think one of the other things the panel report highlighted, which your remarks already did, is around some of the partnerships that are needed in education, but also in research. The vaccine example being, I think, the most relevant today, but there are many other examples, I think, of global scientific contributions that are being made irrespective of boundaries. Science knows no boundaries. Learning from so many country examples. So thank you for that. So I'm going to...
Sure, and if I just may, Erica, I didn't really grasp onto a very good point you made early on, which was about the historical significance of the moment. You were talking about the WHO being born in a crisis. The whole UN system was born in a crisis. I mentioned it was the 75th birthday of the UN system. This does feel like a historical moment. It really does. And to your point about 10 years ago, I think the best way to wrap, and the Canadian Academy of Health Sciences report on Canada's strategic role on global health, which I had the privilege of chairing, I think one of my favorite quotes these days for all kinds of reasons, and I think it's very apt to the points you're making, is from Martin Luther King about how the long arc of history bends towards justice. And I think that's what we will see. That's what we are seeing in global health generally. And that's what we will see in relationship to the experience with this global health crisis. And of course, that implicates all the different types of inequities that we're facing in the world, and all the crises, not just COVID, but also the climate crisis, the Black Lives Matter, and so on. So I thought that would be a good way to wrap it up. And the main feeling I have is that this is a historical moment, and I feel really privileged actually to be here and to be supporting Dr. Tedros, who is such a calm, principled, and resolute leader. Very proud, for example, to see today he was named one of Time's 100 most influential people. But the issue there is his grace under pressure, to use a phrase from Hemingway, and the ability, and I think that saved many lives. And the point I was trying to make also in the opening comments, and I hope this came through, is leadership matters. Leadership really matters in international organizations, at high levels of countries around the world. It's extremely important in how we respond to a crisis, and that is in all of us. And that's also my advice to young people, which is think about yourself and how you're being leaderful, and how we can all lead towards a better world.
Yeah, I agree. I mean, I think that's a really important reminder, and also something that we can't take for granted. Many of the public health frontline staff in Canada, for example, some of them have come under attack and have received threats, and they're just trying to do their job under extremely difficult situations. And if I may add the gender dynamic, many of our public health leaders are women, not just at the federal level, but also in some of the provinces. So it's put a huge strain, but I think they should be commended for the kind of steadfast leadership that they're providing during a crisis.
Absolutely. Absolutely.
Yeah. So I'm going to turn to the questions. So the first one actually is about the response of local communities. So we've kind of hovered more at the global level. We've had some country sort of level discussion, but what is the local communities in times of global health crisis? What kind of actions specifically should we expect from local communities in response to health crises like this? What is the most proactive and timely response that we could be doing as individuals and communities to mitigate the second wave? And there's obviously not just one answer to that, but any thoughts on that question?
Yeah, I mean, firstly, just let me agree with the importance of local communities. And when I was talking about primary health care, people think about primary health care as like basic. It's not basic health services. It's access to essential health services, as you said, Erica, determinants of health and the multi-sectoral issues, and then community empowerment. And so implicit in everything about primary health care is the importance of local communities. Local communities know best what's happening in their community. And so it's extremely important. And in a sense, it's the bond of trust between local communities and governments that is really at the center of at the center of leadership. On a more practical level, local communities can do so much. The importance of community health workers, the importance of helping each other out. I mean, just as an example, I had COVID. I'm going to make it very personal. I had COVID in March. My wife had COVID as well. We were in our apartment. Simple things like how you get groceries.
Mm-hmm.
I mean, these are things that we can all help each other with.
Mm-hmm.
When we're sick, we can remind each other to physically distance. We can remind each other to wear masks when we're in places that masks need to be worn, like, for example, when we can't physically distance. There's so much that communities can do. It's intrinsic to primary health care, the work of communities and of community leaders in terms of trust, in terms of vaccination looking forward. Everything relies on the importance of communities. And I just gave some practical examples there as well.
Mm-hmm. Yeah, I think that's an excellent point. And it also links back to our discussion about Indigenous peoples and their ways of knowing that really need to be privileged. There's untapped knowledge in communities that really is needed to be brought to the forefront together with the best available scientific advice when we're confronting crises like this.
Absolutely.
And the next question we have from the audience is that, which is really around the new normal, if there is such a thing for WHO. So we're all requested to prepare for a new normal in all aspects of life. Could you estimate what would be the new normal for WHO, or what would WHO look like in 3 to 5 years? Actually, and I'm just going to read the comment was, the structure of it, its regional structure. Any thoughts about what might inform that? Within the confines that you're able to answer that, I appreciate that may be a difficult question for you to answer.
Yeah. So, WHO will welcome the recommendations of the independent panel in terms of the emergency aspect per se. And of course, that panel is looking at the international response generally, including but not limited to WHO, and it will be reporting back to all member states. And so I think there'd be a lot of important recommendations made, and we'll have to learn. I think, I didn't appreciate when I came here just how significant a footprint WHO had in 149 countries.
Mm-hmm.
And actually the bond of trust between the governments, and particularly the health ministries in those countries, and WHO supporting them. And I think what COVID has shown is the importance of WHO and of the multilateral system. Maybe the last point I'll make is I mentioned that the stimulus spending in G20 countries has been more than $10 trillion.
Mm.
The expenditure of WHO is about $3 billion a year. Its budget is about $2.5 billion. Its expenditure is about $3 billion. And because of different ways of budgeting, it's not overspending. And so I think we really have to ask ourselves about that. The budget of WHO is the same as the budget of a large teaching hospital.
Mm-hmm. Mm-hmm.
And we see just how important WHO, but also the whole multilateral system is. And so I hope that it will be a multilateral system and a WHO where the financing actually matches the risks. We did an investment case where we showed that based on different types of data, that the return on investment in health emergencies in WHO, their published investment case was like 8.1-fold or something. Well, it's not 8.1-fold, it's like 1,000-fold when you actually look at what happened with COVID. And so I think we'll have a WHO that continues to be humble, continues to be well-led, continues to be extremely science-based, continues to support governments, continues to promote primary health care in the ways we described, has quantitative goals, has learned the lessons of COVID, is helping countries in the world to get back on track towards the Sustainable Development Goals, and where the support for WHO is commensurate with the task that it's asked to take on.
Yeah, it does kind of remind me of the many discussions we've had in Canada about public health and investing in public health, when we can't even get an accurate estimate of how much we spend in public health. It ranges between 2 to 3 up to 8% of the total healthcare spend in many provinces and territories. Yet when a crisis strikes, we expect heroic efforts that are not commensurate with the financial investments that are being made. And so I think hopefully this will be an important opportunity to think about our investment strategy for health and health systems, and if we have the balance right. But this is not a new idea, because as you know, many reports came out of SARS back in 2003-04 that were saying the exact same thing. So I think it's an important time for reflection. The next question is actually a little bit more about your personal experience with WHO, and you've already alluded to some of the big successes from your perspective, but if you had to say, what was WHO's biggest success during the COVID pandemic, what would it be? Or more generally, since you've joined WHO, and you, I think I've addressed this, but if there's something that kind of stands out you'd like to comment on, I'd love to hear from you.
Yeah, I mean, I think just to reinforce some of the themes, I think that you know, and it's why I feel so privileged to be there. I think Dr. Tedros' calm, principled, resolute leadership under fire, grace under pressure, I think has been very, very important for the world and saved many lives. I think the commitment of a wide range of people within WHO, many of them, as you pointed out, women leaders, people from all around the world. It's an incredible group of people who are working day and night and around the clock to save lives. So that commitment has, I think, been really important. But at the same time, I want to say that a lot of the action is in countries. Mm-hmm. And so, you know, the real kudos here go to the frontline health workers in every country in the world who put themselves in harm's way to save the lives of others. And it's absolutely heartbreaking when you see the photographs of health workers who've died, and essential workers more generally, you know, the cleaners, the grocery store clerks. It's heartbreaking. I just saw a statistic that 14% of the 14% of the deaths, I think, might have been confirmed cases or health workers. So very significant share, overrepresented, because only about 2 to 3% of the people in the world are health workers. And so health workers are heroes. Frontline health workers, essential health workers, they're heroes. So I know I shifted a bit from WHO, the institution, really to the people it's supporting, and in a sense, it's supporting all the people in the world. But I want to particularly recognize the heroes, the health workers, who are putting themselves in harm's way for the benefit of others.
Well, and I think that underscores the impact that strong collaboration facilitated by WHO and other countries working together can have on helping to enable people on the front line to do their job, because they don't often have a choice not to go to work. And given their essential nature, as you've outlined. I'm going to shift gears a little bit. The next question is actually around accessibility of tests. And so this has been a hot topic in the management of COVID. So the person from the audience asking this question is asking, why is it so hard to get access to antibody testing and home saliva tests? Is there anything that can be done to make these two tests and other relevant tests, such as rectal swabs, more accessible? What are some of the challenges with respect to accessibility to tests from where you sit?
Yeah. So obviously every country regulates its own tests. But the main test, when we say testing, first and foremost, what we're talking about is PCR testing, the polymerase chain reaction that measures the presence of the virus in people who are suspected cases, whether or not they're symptomatic. And so, for example, when I had COVID in March, somebody put a long Q-tip in my nose to the back of the throat, and it was a PCR test, and that's how COVID was diagnosed. And that is also the test that's based on the genome sequence that came in the second week of January, where the protocol for that test was on the internet from a WHO partner lab by the third week in January and rolling out around the world. And WHO shipped millions and millions of diagnostic kits around the world. So just when we say testing, there's all kinds of different tests. That is the one I want to put in the front window. Then, you know, Canada actually had, and then it's very important that we innovate on different types of tests. There's other point of care tests, antigen-based tests, antibody-based tests. They all mean different things, and we won't go into it in technical, great technical detail here, but the most important thing is which of these tests are actually approved and for what use in your jurisdiction. So for example, a serology test, the presence of antibodies. I have antibodies because I also had an antibody test, but it's not 100% clear how long that immune response lasts, how strong that immune response is. And as I mentioned, it's a virus that we're learning new things about all the time. And so the question was, why is it so hard to get tests? That PCR test is really the bedrock of our ability to find the virus, isolate, put it in the penalty box, and we need to innovate so there's better tests, more frequent tests, et cetera, which is a matter of local regulation and local jurisdiction supported by global collaborations like through WHO.
Great. Well, the next couple of questions I'm going to combine because they actually speak directly to your call to the next generation. So for people working in global health, what would you identify as some of the most significant skill sets to becoming a leader in global health? And, you know, if you can reflect also on students interested in a career in global health, what advice do you have for students to develop these skills and address the future and ongoing crisis? So I guess it's basically career advice based on your extensive and diverse experience for any student who wants to pursue a career in global health, including with the WHO. Any advice you would have?
Yeah, thanks. I mean, it's a real privilege to actually be able to have some time on that topic because I feel so dedicated to young people. Let me just say up front that on Twitter, I'm at Peter A. Singer, and I'm happy to continue to interact with young people and people listening to this as we go along. At Peter A. Singer. Let me just say a few things that I've learned. The first one is that it's really important to fail and to learn from failure and to learn the lessons and learn them quickly. So the ability to be mindful about your own failures, and we all fail. I've had huge failures. We all fail, and to learn from it and move on is extremely important in the skill set. I'm not answering in terms of content, I'm actually answering in terms of attributes. Secondly, my advice to young people has always been find a problem and solve it. Find a problem and solve it. Because only through that kind of action, and sometimes you'll fail and then you'll move on to a bigger problem, only through repetitive problem solving, and that can mean a problem in political science, it can mean a problem in scientific testing, diagnostic testing, find a problem and solve it. And thirdly, I would say if you see a rocket ship, hop aboard. So if you see something that's really moving, hop aboard. Get yourself a mentor. Ask yourself, who is doing now what you want to be doing in 10 years? Who's the most, and that is, I think, really important. And then finally, I'd like to come back to the point about gender equality, Black Lives Matter. I think all of us need to really be mindful about our own privilege and about making way for a new generation of leaders. You mentioned women leaders, leaders from racialized communities, because until we have that kind of strong representation in leadership, and the talent is there, we just need to recognize it and support it. And so I guess those 5 things may be too much to, more than what you were bargaining for, Erica, but I really feel passionate about all of us being able to provide our best advice to young people to make it as efficient and effective as possible for them to achieve their full potential. Like the students and like the young people that are part of the organizing committee here, and like the people that are listening, and like I'm sure the people in your classes. So I don't know if you find, or if people find those types of things useful. Often it's very particular to someone's particular situation, but just off the top, there's some suggestions that I might have, or some thoughts.
Yeah, I mean, I think you also, I think that's great. It's hard to boil it down to one thing. It's such a complex field. But when you yourself said when you arrived at WHO, there were many things you learned arriving there. And so understanding institutional context from the outside versus the inside, I think has been, you're always learning, right, at all stages of one's career. So I thought that was really an important point you made.
Yeah, and you had a WHO element to your question too that I didn't glom onto, but I mean, the main thing I've learned at WHO is how important WHO is. I was kind of a critic of WHO in the first instance, and many people are, and certainly there's stuff to criticize, but you know, when you look at it in a crisis and even before the crisis, it is so essential, WHO and the multilateral system, to the poorest and most vulnerable people in the world. It is so essential. And you asked what I learned. Maybe that's the biggest thing I learned.
So I think we have time for one more question. And so this is actually about the implication of the US choosing not to be involved with COVAX. But beyond the US, what are countries like the US risking by not joining COVAX? I mean, what's the value proposition, maybe is another way to put it, rather than getting into the politics of individual countries, just to respect your position. That might be a way to perhaps respond. You know, what is the value proposition of being a member of COVAX? Yeah. Several countries have signed on, so clearly it's worked for some.
Yeah, thank you. I mean, just off the bat, a few things. As I mentioned, you know, not even the richest and most powerful countries can make a bet on 200 vaccines. So hedge your bets. You know, together we can help move them all forward. Separately, we'll have to make bets. And what if your bet is the wrong one, or your bets are the wrong ones? So there's a clear bit of self-interest there related to vaccine development. Secondly, in terms of equitable access, COVAX really stands for equitable sharing and access. The idea I mentioned of providing vaccine to some people in all countries before all people in some countries. And there's modeling that actually shows that that decreases death rates. You know, thinking about protecting health providers, health workers, thinking about protecting older people in countries around the world and people who are most vulnerable. Finally, and this is also an issue in self-interest, a lot of the international economy depends on international trade and travel. And international trade and travel ain't going to be restored as quickly unless COVID is addressed in every country in the world. And so I think there's 3 things off the top in terms of real benefits. And I tried to focus not on the moral benefit, because there's clearly a moral case in equity, in sharing. for countries around the world. I tried to focus in issues of self-interest. So I think countries are missing out a lot, and I know many countries continue in discussions, and I hope that they will join, and I hope countries that have joined, like Canada, will encourage others to do so.
So it looks like one more question, if I may, to sneak in before we move to closing remarks. So do you feel that there's an area of global health that is underexplored by existing curricula and in research that students could benefit from learning more about or exploring?
Yeah, I mean, rather than answering in terms of a specific domain, because then I'd be arbitrary, let me answer in terms of a principle. Mm-hmm. And I think this is useful. I hope this is useful for people. You know, our mindset is often to go where the hot topics are. So we all go to areas that we think are, but one thing that people might consider is to go where other people are not. In other words, what are you passionate about, where you feel that a particular perspective, a particular approach, a particular focus can make a difference in global health or in domestic health, because health is universal, and that is really underrepresented. And maybe that's the way to think about it. Just as a concrete example, I learned this when I went into bioethics in the early 1980s. Very few people were talking about bioethics at that time. And certainly those that weren't talking about it in the way of developing kind of constructive tools on the inside of a profession. It was mostly a kind of philosophical critique of outside the professions and institutions. And so, you know, that's the point at which I learned that you want to go to where people are not rather than where people are. And I just use that example, and, you know, apologize for using one from my own experience, but I think in terms of where people should focus in global health, they should focus in an area they're passionate about. Mm-hmm. They should focus in an area that leverages their skills. So if you're a laboratory scientist, don't dig a well for water. If you're an engineer, dig a well and maybe don't do PCR. Leverage what you've got, go into an area that you're passionate about, but find a place and an approach where people are, you know, are not.
Mm-hmm. Yeah, I think that's really good advice. It kind of reminds me of why there are so many neglected issues, and we need champions to bring those to the forefront, and also to elevate the voices that often aren't heard, and to also give others, including the many different communities, voice. So thank you so much, Peter. I'm going to turn it back to our colleagues to bring our session to a close, but it's been a real privilege to have a chance to chat with you.
Well, it's been a privilege for me, Erica, to be with you and with your colleagues and with everyone viewing, and I really appreciated the opportunity to be with you. Merci.
Merci.
Thank you so much, Dr. Singer and Dr. Ruggiero. Good afternoon, everybody. My name is Chan Monroe, and I'm the secretary of this year's Hart House Debates and Dialogue Committee. So as we conclude our first event of the year, I just want to take a moment to thank a few individuals without whose generosity of time and effort this event would not be possible. So first and foremost, an immense thank you to our distinguished guest, Dr. Singer, for his time and presence in joining us this afternoon. It was an honor to host you as the keynote speaker at our inaugural event and to hear from one of the most knowledgeable and accomplished individuals in the field of global health. So thank you very much for your attendance, and thank you for engaging with us on these critical topics. Next, I want to offer an enormous thank you to Dr. Di Ruggiero for being the moderator of today's event. Thank you for generously providing your time and expertise to facilitate the conversations that we had today. We could think of no better individual to moderate today's event. Thank you so much for being with us today. It was an absolute privilege to have you with us. A huge thank you also to Hart House for providing this platform of discourse, and a big thank you to two specific members of the Hart House staff, Danielle and Olang, for their invaluable help in ensuring that we could hold the best version of this event from planning to execution. especially considering its unprecedented virtual nature. A huge thank you also to the members of the Hart House Debates and Dialogues Committee, specifically the members of the Alumni and Keynote Subcommittee, Wen and William, and the committee chair, Priscilla, in their tireless dedication and hard work in planning and organizing today's event. Thank you to the communications team, Heather, Karen, and Ruvanya, for their efforts in publicizing this event to the general public, and to the treasurer, Nicole, in assisting with the behind-the-scenes facilitation of the event. So from our speakers, the Hart House staff, to the members of the committee, thank you for your invaluable role in making this event possible. Finally, thank you to you, the audience, for joining us today. It is greatly encouraging to observe that despite the current barriers of the pandemic, that has not deterred us from using this forum as an opportunity for discourse and to engage with today's most pressing topics. So thank you for your interest and for your attendance at our first event of the year. We hope that it was enjoyable, captivating for you, and thought-provoking. So our next event of the year will take place on Thursday, October 8th at 6 p.m. Eastern Standard Time, titled Defunding the Police, Reinvesting in Our Communities. The event will explore the topic of police reform within our communities and will feature as guest speakers Councillor Mike Layton, Mr. Julian Falconer, Dr. Suzanne Stewart, and Dr. Julius Haig, in a panel discussion that will be moderated by Ms. Garcia Bailey. This concludes today's event. Thank you for your attendance, everybody. We wish you a great rest of the day. So please feel free to exit the Zoom call.
Thank you.
Thank you.
Thank you. Bye, Peter.
Bye-bye. Thank you.